In today's COVID-19 update, pregnant women and breastfeeding mothers are encouraged to take the COVID-19 vaccine.
The vaccine does not harm pregnant women, does not harm the unborn child. There are millions and millions of persons who would have received the vaccine during pregnancy and it had no effect on the baby. So among the obstetricians globally, the advice is that you should get your vaccines during pregnancy. And the earlier you get it, you are going to be protected, because during pregnancy, women can become more vulnerable to COVID, and therefore these vaccines can be very, very protective. So I want to urge pregnant women in Guyana to make sure they get their vaccines during pregnancy. This is very important if you are going to prevent infection from occurring. For those breastfeeding mothers too, again, there's no contraindications that during breastfeeding that if you get the vaccine, it would harm the child. On the contrary, if you get the vaccine, you can produce antibodies, some of which would pass through the breast milk and would help to protect the baby. So it is better for you to get the vaccine if you're breastfeeding.
It's a big issue, and we continue to talk about it every day. Cases are going up. Could we start with our latest active cases figure?
As you rightly said, because of the Delta surge, we are going to see an increase in cases. Over the last 24 hours, we would have conducted 2,346 tests at both private and public institutions, and we had over the last 24 hours 313 cases. This is perhaps the highest that we have gotten in a 24-hour period. Currently, the active cases that we have now 3,368 persons with active COVID across Guyana. Of those cases, we have 1,955 in Region 4, and we have another 805 in Region 3.
Minister Anthony urges persons to pay close attention to the numbers, because unless precautions are taken, the infection rate will go up, which in turn will result in increased hospitalization.
Well, monitoring got to be everybody's business. If people are non-compliant and we see those persons, then we should tell them. So it's not just a task force business, somebody going to be running around trying to enforce all of this. Each one of us, if we want to be protected, then we have to talk to those who are not doing the right things. It's only by all of us doing the right things that we as a population, as a country, would be protected. So it's everybody's business, and we have to change our behavior, we have to adjust, or we're going to get sick. And it's simple as that. As of yesterday, we have administered 534,185 doses. And to break that down, we have given so far 19,131 doses of Pfizer vaccines to children between the ages of 12 to 18. And that accounts for about 26.2% of that cohort. In terms of the vaccines for the adults, we have given so far 339,206 doses to persons 18 years and above. This is now 66.1% of our adult population. And for second dose vaccination, we have given out 175,848, which now accounts for 34.3% of our adult population. No.
Well, that's it for today's COVID-19 update. Of course, we just spoke with the Honourable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and the Ministry of Health's website as well, health.gov.gy, and of course our social media platforms.